Hi, Dr. Casello. Nice to meet you.
Come on in. I'm going to have a seat right there. Okay. Well, welcome.
Thank you.
So how can I help you? What brings you in today?
Well, I turned 50 this year,
Okay.
so do I need to say anything more?
Okay.
I'm just feeling like I'm feeling like I'm starting to look my age,
Okay.
and I feel like I've waited a long time to take care of myself and taking care of the kids for a long time.
Okay.
So I think with the advent of the 50, I decided it was time for me. Yeah.
Okay, good.
So.
Okay, is there any one area or one thing that when you look in the mirror that bothers you?
Well, I don't really, I guess the first thing would be like the tone of my skin. I feel like I have a lot of redness.
Okay.
Blotchiness.
Okay.
I just feel like I feel like I can see lines in my face that I didn't have before.
Okay.
And I'm not really good about taking care of my skin. I don't really, I've never really been educated in how to take care of my skin and what sort of products to use. So all of that I think is important as I get older.
Okay. So what are you using now for products?
Dove.
So
my mom told me that when I was like 19. I've been sticking to that for a long time.
Since you were 19.
Yeah,
okay,
it's been a while. It's been a long time.
That's good.
And you know what? Honestly, I don't even know. I'd have to bring it in with me the next time. I have a moisturizer that I buy at a store in Worcester.
Okay.
She said it was clinically, a nice product, and I've been using that for a few years.
Okay. And you use that once a day?
Yeah. Well, twice a day, morning and night.
Okay. Now, do you wear sunscreen?
During the summer, I do, and the product that I use for moisturizer does have a built-in sunscreen.
Okay. Do you know what the SPF of it is, or?
I feel like it's 30.
Okay.
But again, I'd have to bring it in.
Okay. So you wear sunscreen mostly in the summertime?
Yeah, I do spend a lot of time in the sun, and have my entire life. So that's another thing, of course, that I'm concerned about, maintaining what I have left of my skin.
Okay.
So I am pretty good. I'm very good about keeping sunscreen on during summer.
Okay. All right. Well, let's talk a little bit about what I see and what you see, and maybe we can come up with a plan that would work for us. Okay. So the first thing I always tell people when I look at faces, I always think of it in terms of a beach ball. Okay. So when we're born, our beach ball is nice and firm. The colors are vibrant. If over time you left that beach ball on the beach, it would start to shrink, and the colors would become splotchy or dull. In some places, probably disappear altogether. Okay? So what we want to do when we look at your face, that's what we're looking at.
The beach ball?
So, the beach ball. So let's look at the outside. So the first thing I'm looking at is I'm kind of looking at the reds and the browns and the texture of your skin. And when I look at you, I say, well, it's not too bad, to be honest with you. You don't have a lot of sun damage, a little bit of browns coming out, especially in the temple area. And you do have a little bit of some ruddiness or redness on the cheek area, and some texture issues around the nose and cheek area.
Yep.
So those kinds of things will need to be addressed, and I'll talk to you about ways that we can address that. The other thing is when we look at the inflation and the deflation, we're starting to deflate a little bit. And again, that's that beach ball starting to deflate a little bit.
Yeah.
And what's happening is you're starting to develop some of these lines here and around here, and some hollowness around here. And that's just a matter of really kind of blowing up the beach ball and replacing those things that are lacking in the skin. The scaffolding that our skin sits on starts to shrink as we age. So really it's a matter of putting in some product or stimulating that collagen to repair itself. And there are ways that we can do that. So the first thing, you had said that you were concerned about the redness. Okay. What I probably would suggest for that to start with is maybe a series of some intense pulse light treatments. Those will pull out the redness and also will address some of the textural issues, and it will also pull out the pigment. So what that would entail is probably a series of between 3 and 6 of those treatments spaced a month apart.
Okay.
That's what I would start with.
And it's a process that you go through for 6 months.
Yes.
And it changes the texture of your skin.
Yes.
And it's going to get rid of some of the ruddiness.
Right.
Okay.
Right, and some of the browns.
Okay.
So that will, give your skin a nicer texture, some of this roughness in here. It also will pull out some of the ruddiness and any of the brown pigment.
Okay.
So I would suggest that we maybe start with a series of that, 3 to 6 of those, spaced a month apart.
What is it invasive? Like, how do you do it?
Good question. What it is, it's an intense light, and it's pulsed onto the skin.
Oh, okay.
What we do is you come in, we wash off your face, we put a cool gel on it, we put goggles on you, and then we pulse this light onto the skin. And by doing that, it takes the pigment from this layer here, and it brings it up to the surface,
Okay.
and then your body reabsorbs it.
Oh.
So that's how your body gets rid of the pigment. It comes up to the surface, breaks up, and goes away. So, and once that pigment's gone, it's gone, again, if you wear sunscreen, it should not come back.
Okay.
But if your skin has been damaged, those pigment cells have been damaged, then it will produce more pigment over time. You come in, we do another treatment, we pull it out, and it's gone again. Okay? So that's what I would suggest to start with, to get some of the ruddiness and get the pigment out.
Does it hurt?
Good question. It's actually pretty comfortable. What it will feel like is a rubber band snapping on your skin. Okay? And we can adjust it so that it should be comfortable for you. We blow cold air on your face during the procedure, and if it's really uncomfortable, we can numb you prior to it. Although most people don't need that.
Okay.
Okay? When you leave after the procedure, you might be a little red like you've been out in the sun. 2 or 3 days later, you might notice that the pigment is actually darker. The ruddiness is maybe darker, and that will go away over maybe about a week's time. So that's what I would suggest, for the outside to start.
Okay.
And then I would also suggest maybe blowing up the beach ball a little bit. And that was right. And that would be what we call dermal fillers. And dermal fillers are substances that we put into this layer of the skin to basically reinflate it.
Okay.
Okay, and in putting it into this layer, it will stimulate the collagen to repair itself, depending on what product we use, and that will plump up the beach ball, so to speak. So if you can see these lines right in here, when you look in the mirror, if you were to, in this line here, if you were to fill it up, we'd want it to look more like that. See the difference?
Oh, yeah.
Okay. Now, it's, again, very subtle. We're not trying to change your appearance. What we're trying to do is restore what you've lost. So just repair what you've lost. So in doing that, we would put it in here and see the difference.
Yeah, I do.
Same thing right down here. See this right here?
Yep.
By doing that, see the difference? Okay. It's very subtle, but it's a much more youthful look.
Yeah.
So I would say probably to start with some dermal fillers to plump up the, and just to sort of soften those lines.
Okay.
Now, these kind of lines, when you frown, okay, when you raise your eyebrows, okay, when you squint, your eyes really tight, these kind of lines here, these are what we call dynamic lines. They're a little bit different. Those lines occur because over the years you've laughed, you've cried, you've yelled at your kids, you've scowled, whatever. You've made expressions.
I've worked for these.
You've worked for those. And what happens is over time those muscles become bigger and they pull and pucker the skin. So those would be the kind of lines that would respond really well to Botox or something that relaxes the muscle. Okay? So there's a lot of different products. There's Botox, there's Dysport, but it's something that would relax the muscle. And that we would do is probably put it in here to soften so that when you scrunched it didn't go as deep.
Yep.
And when you raised your eyebrows, these lines would be softened, and when you scrunched your eyes, these lines would be softened too. Okay?
Right around there.
Yes,
Yep.
right.
Yep.
So I would suggest that maybe some fillers and a little bit of Botox to get started, and I think that would give you a really nice soft look. The final thing is products. At your age, I always liken it to putting sprinkles on a cupcake, okay? When we're young, if we have a nice cupcake and great frosting, we put sprinkles on it, it looks great. But as we age, that cupcake gets a little bit broken. We need to repair that. So what you want to do is you want to deal with more pharmaceutical-grade products.
Okay.
And those are the products that, instead of sitting on the skin and making it look good like sprinkles, actually gets into the skin to affect a change, okay? And at our age, and I can say that because I'm older than you want something that's going to actually repair the skin, and it's going to change the skin to maybe take out the pigment, to grow collagen, whatever it is that we're trying to repair. So I would suggest that we get you on some good products that you can use, and over time that will work with anything that we're doing here. So it'll work synergistically.
Yeah, there's so many products out there that you just get confused.
Right, exactly.
It's almost like you don't even know where to start.
Exactly, and that's what we'll educate you as to really what you should look for in a product, and products that will work on your skin type and to give you what you need to achieve your goals. And we will go through, and again, it doesn't need to be a lot of products. Just a few good products that are in the concentrations and the delivery system that you need will really make a big difference in your skin, and you'll see a big difference over time.
That's exciting.
Okay. Do you have any questions so far?
No, I guess just more of a comment. I mean, I think that one of the resistances that I have, I've worked hard to be me, and so I think changing the way I look wouldn't be the appropriate measure, but it sounds like everything you're laying out makes sense. It's blowing the ball up again makes a lot of sense to me.
Yeah, and I think that that's probably most people's fear, is that somehow we're going to change your appearance.
Right.
And that's not what we're going to do. What I tell people is we're really just restoring and softening your look. And the number one thing people will come in here and say to me, am I going to look like, and it's,
Joan Rivers,
Michael Jackson, right, Housewives of.
Right.
And that's not what we're here for. What we're here for is to change your appearance in the sense that we're softening your look.
Right.
If you never had big chipmunk cheeks, I'm not going to give you chipmunk cheeks. What we're trying to do is just soften the look, your look.
Yeah.
Okay.
So take the clock back.
Take the clock back maybe 5, even 10 years.
Yeah.
Okay. You're not 20. We're not going to make you look 20.
20.
You don't want to look 20.
40's good though.
Right, exactly. Or you want to look good for 50, right?
Exactly.
Exactly. So that's what we're aiming. We want a very natural.
Yeah.
We want a very subtle look.
Yeah.
And we don't want to change your appearance in any way other than to just restore.
Refresh.
Refresh, exactly.
Yeah.
Exactly.
Yeah, no, it sounds reasonable, and it doesn't sound as scary now that you've explained it.
Oh, good.
Yeah.
So should we get started?
Yeah, I'm excited.
All right, sounds good.
All right.